A very good afternoon to you all. Welcome to the fifth scientific session of TATVAPRABODHINI. I now introduce the speaker of this session, Dr. Praveen Kumar Chotgal. Sir has completed BAMS from STM College of Ayurveda, Udupi, and pursued MD in Swastavrata from Sri Jagadguru Ravi Siddeshwaraya Ayurveda Mahavidyalaya, Kopla. Sir worked as Assistant Professor in Rosie Royal International Ayurvedic Medical College, Bangalore from the year 2005 to 2018. At present, Sir is working as Assistant Professor in the Department of PG Studies in Swastavrata, Government Ayurveda Medical College, Mysuru. Sir will be speaking on the topic Preventive Measures for COVID-19 through Daily Regimens. I welcome you, Sir.
Thank you. This is Dr. Praveen Kumar. I am working as assistant professor. Before going to my session, I want to thank organizing committee for giving me this opportunity. Always saying that prevention is better than a cure. No, I am going to share view on preventive measures for the COVID-19 through the daily regimen, which we can practice in day-to-day life. As all we know, that is a portal entry of the virus that is mainly to the eyes and the nose and the mouth. After once virus is entered into the these organs, then that will adhere to the mucous membrane. After once adhere to the mucous membrane, that will then enter into the take shelter into the throat, and there that will stay for few hours, then invade into the lungs and produces the different sort of the diseases. In according to our classics, according to our Ayurveda, they are targeted whatever I explained, dinacharya, rutucharya, or rasayana therapy. They are mainly targeted this portal of entry. That is whatever organism enter into the mouth, nose, or that is eyes. These entry only they targeted. If you take any intervention that is mentioned in the dinacharya or the rutucharya or the rasayana or daiva vyapashraya chikitsa or the viptiyakta vyapashraya chikitsa, those are mainly concentrated on the portal of the entry of the this virus. Whatever procedure explained or whatever the dravyas or the medicine materials we are using in the dinacharya procedure, those act as a biological barrier or the biological, they will make a biological coat over the mucous membrane. So that will, in one word, we can say that will act as a barrier, or that will act as a mechanical barrier. In other words, that will increase the local immunity of the mucous membrane. Also, that will help to maintain the hygiene of the oral cavity and the throat and the pharynx, and also that is eyes and all. So whatever drugs we are using for the dinacharya, those are having not only that what we can say local prophylaxis. Prophylaxis means that is prevention by local prophylaxis. Whatever drugs we are applying, that is, you take the Anutaila or the Tilataila, whatever Gandusha and Kavala Gandusha Nasavasara, whatever drug we are using. So those will enter into the not only give the local prophylaxis or the increases the local immunity of the mucous membrane, also that will enter into the systemic circulation, and in that also they act as a immunity modulus that will enhances the immunity, and that will fight against this deadly coronavirus. So next we will come, as there is no particular medicine or the vaccine still today, there is no particular vaccine or the medicine is developed in the contemporary science for the COVID-19. Only option we left is that is prevention or boosting our immunity by the dinacharya, rutucharya, asara, or any other treatment explained in the Ayurveda. So we are in such a situation that whatever symptoms or whatever diseases or whatever infection if we got means, directly we will then think that that is maybe due to the coronavirus, because such a pandemic condition we are facing. So that is obvious. So to overcome all these confusion, whether it may be bacterial, viral, protozoal, or the fungal, to overcome all this is symptoms, or there is only option is achara rasayana and dinacharya and rutucharya. All procedure we have to follow. So next, there is a, according to contemporary there will be different sort of diseases. For different sort of diseases, there will be different vaccination. So if you take the example of enteric fever, there will be different vaccine. If you take the H1N1, there will be different vaccine. If you take the that is hepatitis, there will be different vaccine. So many diseases are there, so many vaccines are there. For corona, there is no still any development of the vaccine. If you take our regimens, that will not, that is act as a primary that is a local prophylaxis, and also secondary prophylaxis, that is systemic prophylaxis also. That is not only give the mucous membrane health will not be increased, that is also absorbed to the mucous membrane, enter into the system, and again produces the systemic immunity also to fight against the corona. So what we can say, just following the dinacharya, acharya rasayana, and a different sort of procedure which are explained in the Ayurveda, just those things are the enough. So how different for vaccine will be there for different disease? Only single vaccination. That what we can say, that is universal immunization for the all sort of the disease in Ayurveda. That is only one. That is following the Dinacharya procedures. What we can, multiple disease in contemporary cells, multiple diseases and multiple vaccine in Ayurveda for multiple disease. That is maybe pandemic, endemic, or the any disease, only single option, that is borrowing the Dinacharya and Rutucharya, act as a single or the universal immunization. That is for so many disease, only one prevention, that is following the Dinacharya, Rutucharya, another protocols which are explained in the Ayurveda. Next, Daivavapasya Chikitsa. That is very important in this concept. That is, virus we know that is airborne, that will stay in the air for up to 72 hours. According to so many references, that is a controversy also, that may stay for few hours, that will attach to the particulate matter. Air contain not only oxygen, nitrogen and all, they also contain some microscopic organisms and particulates also. Whenever the infected person will go into sneeze, cough, and singing or something, the droplet will be get attached to the particulate matter which are present in the air, and with attachment they will stay for up to 72 hours. Somebody will stay, that is few hours, but almost that will stay, so many references they say that 72 hours. And in the temperature of 20 to 25, if temperature increase means that will destroy, that is more than 45, somebody status up to 45 degrees Celsius, that where the virus survive in the air. For this environment hygiene or the to boosting immunity of the environment is also required. Only not personally, that is local prophylaxis at the simple, that is systemic prophylaxis. In systemic prophylaxis, this is the Rasayana act as a systemic prophylaxis. So environmental hygiene, how we can maintain, that is Daivavapasya Chikitsa. That is very important by putting the Homa Havana and Dupana Chikitsa. Now everybody is using the Dupana Chikitsa. So these Dupana Chikitsa, whatever drugs we are using, those having the antimicrobial action. That is, I will give so many reference of that is scientific reference. So they were having only not only that antimicrobial, they act as an antifungal drugs also. So that will helps to clean our environment. That is also one of the that is a criteria to transfer from one person to other person. So before going to my session, so these are the things, that is primary prophylaxis, that is also act as a secondary, that is in system also they act as a, it is a whatever drugs we are using for the Nasya, Kola, Gandosh and all, they act as a locally, that increases the mucosa by forming the biofilm, and further entry prevents the entry of the mucosa into the throat and then to the that is lungs. And also that will absorb to the skin and the mucous membrane, that is whatever Kavala Gandusha drugs is there or the Nasya drugs is there, that will enter into the systemic, they act as a secondary or systemic prophylaxis. Those are the things. And next other come to the Daiva Vapashya, that is Homa, Havana, Dupana. Those are all scientific drugs, those are the antimicrobial. If you come to the Sattva Chikitsa, I referred so many scientific journals. There is a direct relation between, that is psychological symptoms. You take the depression or the anxiety or any psychological symptom or the psychological disorder, those having directly on respiratory tract. So person who are having psychological disorders, those are very prone to attack respiratory system disorder. Maybe bacterial, viral, fungal, protozoal, that they are more very prone to attack. So in this pandemic, there is very much important to sattva is very important. So maintain sattva, that is yoga and pranayama, practicing yoga and pranayama, that is Surya Namaskara. Those are the things very important. Those will help to maintain sattva. So that can be achieved by that is pranayama yoga and all. That is samatvam yoga michyate. That will balance both the body and the mind in such a pandemic. Next is rasayana. Whatever rasayana we will consume, those rasayana act as a systemic prophylaxis. We will take from the mouth. Those will trigger the immunity and boost the immunity, prevent the disease, and prevent the entry of the microbes. So and so. I will tell detail in rasayana. So introduction, that is global, that is in the form of COVID-19, that is an emergency. So it is not affecting the only health system, that is also affecting the economy of the affected country. You take the India, that is GAD was 2 before this one, now it's come minus. So COVID was the first identified early in the December, that is 2019. And by the middle of the March, the World Health Organization assessed COVID-19 as the pandemic. WHO named Johanna pneumonia, that is coronavirus disease 2019 as the COVID-19 on February 11, 2020. As so far, the majority of cases were reported in US, that is first highest positive cases reported in US, next India, that is second highest, third highest is Brazil, next continues, that is Russia, France, Spain, Argentina, Colombia, and the UK. So if you take a data of statistics, 5% of the cases required intensive care unit, that is ICU care unit required for the, out of 100 positive cases means 5 cases out of 100 cases, 5 cases may be emergency, they are required the ICU management. So disease is prognosis and the gradual. So that will take from upper respiratory tract. First we will get the symptom of upper respiratory tract. Then that will leads to the acute respiratory distress syndrome, that is called as ARDS. So for prognosis, that is from upper respiratory tract infection to ARDS, that may take 9 to 10 days. Then the ARDS that will leads to the hypovolemic shock. That is, vitals will be reduced. The BP will be lower, BP will be there, and tachycardia might be there, and is not able to respond. So it's called as hypovolemic shock. And again, that will lead to the multi-organ failure. That is what we'll say BOTS. Then finally, he may going for the death. So in the early treatment, that is in if he's getting ARDS means if he's admitted to hospital means early diagnosis, early treatment is very good. If ARDS is prognosis to hypovolemic shock or multi-organ environment, that is very difficult. In ARDS, he may require artificial ventilation. So again, he may come out of from the ventilation or may chances for the if old age means there is a less chances to come from artificial ventilation, that is ventilator. Right? India currently has the largest number of COVID confirmations, the highest in the Asia. That is first in Asia. That is first India. Second highest number of COVID cases are reported in the world. That is India is second. Diseases which are highly contagious, you almost know that is highly contagious and replication is will be very fast and spreading nature. There will be effective no remedy. You also know there is no particular medicine or the particular vaccine developed. So quantum says combat over this decision, therefore only prevention. So there is no medicine, there is no action. So there is only option, that is prevention and boosting our immunity. So in this need of our development of safe and effective treatment in the Ayurveda method, that is prevention of this disease is very important. So Ayurveda concept, that is unique specificity of the Ayurveda as a prevention is the single option, because Acharyas given the Dinacharya mentioned in Samhita, which Dinacharya will be play a key role against this fight. The protocol can be easily implemented. So Dinacharyas already I explained, that is act as a local prophylaxis and also secondary prophylaxis by forming the biological layer and enter into the that is act as a mechanical barrier. So Dinacharya includes so many procedures, that the Kavala Gandusha Nasya and all the Udvartana and Udvartana and also other this is also some are directly act as a primarily preventive and some are indirectly act as a prevent this virus or the other microbial infection. That is according to Ayurveda, Samadosha Samagnisya, balancing of Samadosha Dhatumala is called as the disease, that is swastha. If imbalancing, whatever, whether it may be any disease that you take the coronavirus also, there will be imbalancing of dosha dhatumala will be there. Just we have to balance. That is basically we have to start to balance. That is called as health. If you take an epidemiology, already our senior faculty has explained everything. Just I will shortly explain. That is worldwide there is a recovery rate is the 97% and death rate is 3%. And India, if you taken yesterday, that is death rate is 2% and recovery rate is 98%. We should not get exact that recovery rate is highest, but because again cases are repeating after 2 to 3 months, what will happen? Whatever antibodies are developed, those goes on decreasing. Again, chances of infection will be there. There will be the highest morbidity rate will be there. If once recovered means there will a post-COVID status, he may get so many complications like the cardiac complications, CNS complication, breathing difficulty, or so many other complications. He might have the myocardial infarction or CVA. So many complications also will follow. So it's better to prevent this disease because that might be highest recovery rate might be there, but so many complications we will get. Also, there are the chances of second and third attack. So we have to be careful, and that's better to prevent this disease. India demographic cycle, that is main men and the older population is mostly attacked. Morbidity rate, but is complications of the corona, that is mostly we seen in the cardiovascular disease, CKD, that is chronic kidney disease, hypertension, diabetes, and the respiratory disease like carpal tunnel and all. Next, if you take in the according to age group, less than 40% affected 47, that is 40 to 60%, 33% affected. Above 60 years of age, that is 19% affected. If you taken according to gender, that is male affected more compared to female, that is 76% in male and 24% in female. And that is mortality is also high in male, that is 73% compared to female, that is 27%. Also, fatality, that mortality linked to the comorbidities, that is 86% of the deaths recorded, that is due to the comorbidities like hypertension, diabetes, and the heart disease and the CKD patients. Out of this 86%, if 100% death is that means 86% death due to the comorbidities only. So out of it, this 86%, 37 of these deaths are more among below the 60 years of age, that is highest death rate is there. Next, according to mode of transmission, Ayurveda, Prasangat, Karta, Samsosha, Bhojana. So that is, we can correlate this with the directly social distancing principles. So if you not following this Prasangat, Karta, Samsosha and all, if you follow this, then will leads to the Janapadadam Sakravadis or Sankramika rogas like Kushta, Jwara, Shosha, and Netra Abhishanta. That is called as Aupasargika roga in the Ayurveda. That is nothing but Shushruta told in Kushta Nidana. That can be correlated with the social distancing principle. If you not following, that will lead to the Kushta, Jwara, and Shosha. Similarly, whatever hygiene principles we are following nowadays, that is same only. Next, clinical features, 98% of the patient will get a fever, and fatigue will be there in 69% or 69%, and along with the dry cough and the diarrhea. According to symptomatology, we can divide this into mild disease, moderate, and the severe. Mild, there will be upper respiratory tract infection will be there. That is, I told, that will take to upper respiratory tract into the ARDS, that will take 10 to 12 days. Moderate, this is there will be a cough, shortness of the breath, and tachypnea. Just oxygenation is supplementation is required in moderate to mild cases. If it's prognosed to severe, then it will lead to hypovolemic shock and the severe pneumonia, and that will leads to the MODS. MODS will leads to the death only. MODS means multi-organ dysfunction syndrome. The next Ayurvedic understanding, that is almost Charaka Vimansthana explained, Janopadadamsa. Primary cause of Janopadadamsa, that is that is losing integrity, that is imbalancing between the Vayu, Jala, Prithvi, and Kala. That will lead to the Janopada Dhamsa. That is climate, air, water, and become the common medium through which these diseases affect a large population. That is same what we are observing in this pandemic, that is COVID pandemic. That is root cause, that is dharma. Adharma, that is meaning unsuitable way, that is pradnyaparada. Adharma will leads to the pradnyaparada. Pradnyaparada again will leads to the Vaisheshana of Vayu, Jala, and Prithvi and Kala. These Vaisheted Prithvi, Jala, Kala, again will spread the disease to the large population. That is called as, according to Charaka, that is called as Janopada Dhamsa. That is nothing but the pandemic. So that is because of mainly Adharma and Pradnyapara as the basic reasons. Next, who is susceptible? That is who are having cardiovascular disease and severe asthma and immunocompromised status like HIV and tuberculosis and morbid obesity, diabetes, CKD with who are on hemodialysis, and people with the liver disease. How does that like? It's like coronavirus is spherical, so with a club-shaped glycoprotein. Next, how does it enter to the cell? So simply, I will in simple words I will explain. That is angiotensin enzyme. This is angiotensin. Converting enzyme, it will go and stick to this. Next, this is human cell. This will absorb into the human cell and then affect the other systems also. Like this, it is not only present in the lungs, but also that is present in the arteries, heart, kidney, and the intestine. Next, if you take how does immunity response? Once virus enter into the here, this virus is entering here, but here only we can prevent. That is by primary prophylaxis by following dinacharya and the rucharya. This entry only we can prevent it here. So once entry virus entered into the body, that will stimulate the T cells or T activation. T cells will be activated. Again, these activated T cells release the cytokinase, and due to cytokinase, again proliferation of the T cells will take place. So all these T cells will help the destruction of the coronavirus in the, that is by the process of phagocytosis. So this also we can compare with the Ayurveda by consuming the that is ashwagandha and all rasayanas. They act as a systemic prophylaxis to fight against this coronavirus. Next is Dinacharya. This is also in this journal, that is Dinacharya procedures and Rutucharya procedures. They act as a local prophylaxis. That is maybe drinking medicated water or the Kavala Gandusha Nasya. That is the GICM purpose. I think lifestyle Dinacharya that we should be early in the morning. That is 1.5 hours before the sunrise. The meditation is that we have to perform meditation in that time. The hyperactivity of the hormones become the normal, and sattva, which is a quality of the mind, that is activated. So there is a less chances of pradnyaparada. So already we know pradnyaparada is the mula karana or the main karana to for the janapada dhamsa. If you are avoiding pradnyaparada, getting early in the morning, so we can avoid this COVID disease. Early morning wake up also stimulate the melatonin, which is more elevator and helps the mind to keep active and alert state for the whole day. Also, there is a copious present of five bhutas: Shuddha, Vayu, Shuddha, Akasha will be there. So environment will be clean and the hygiene. Also, Brahma Murta, that is compared with the Shukra, that is Sarman. Wake up early in the morning, that will help to preserve the Shukra. By preserving the Shukra, again, we can boost our immunity. Grita Yama Darpana Darshana. This is also very important. That is having psychological effect also. And this one, looking on the face in the Grita, olden days they want to look at the Grita, and mirror helps to outcome from the mental confusion. Although psychosomatic disease can be avoided. This is again allow us to see and clean the accumulated secretion from the eye and the nose and the ear, which may cause unsightly appearance, even infections like the corona. By cleaning the all, by seeing this, we can observe any unsightly, any dirt or something is that means we can cure, we can wash it, and further we can prevent the entry. The next is Usha Jalapana. According to Ice Ministry also, they explained 1 to 3 glasses of warm water that should be mixed with tulsi leaves, that should be consumed per day. At least 2 to 3 liters of water should be consumed to flush out whatever morbid matter is there in the body. According to Ayurveda, that is 648% the water should be consumed. That acts as an immunity booster and also stimulate the hunger, and also that will cure the disease of the jura. Also that will cure ear, throat, and head. This is also cured. Malamutra Visarjana, that is also defecation, that is important. That is gives the Bala, Vritti, Ayush, and all. Achamana, that is no, we can correlate to the hand sanitation. Whatever we are doing in previous tests, they want to, if they come in contact with the morbid or the inauspicious matter, they want to wash their hand and feet. Similarly, now we are practicing that is the sanitization and oral hygiene and social distancing and social hygiene. Dantadavana, this is also having direct prevention and act as a primary or the local prophylaxis to prevent the COVID. That is whatever drugs that is Acharya have advised, that is twice a day we have to practice, and Madhu Taila, Tila Taila, that should be mixed with the that is Dantadavana drugs, and gently we have to rub over the teeth. Preventive aspect of this, that is dirt from the oral, and it will maintain the oral cavity hygiene, and promotive improves the taste perception, lightness, scraps the accumulated kapha, and by there increase the oral immunity to fight against the microbes like corona. Next, this is also according to World Journal of Pharmacy. That is also same. That is maintaining the oral hygiene. That is important to prevent the health. That is manage the health and also prevention of the disease. That is because whatever drug, that is Karanja, Karavira, Arka, Malati, Arjuna, Asana, etc. Whatever drugs we are using for the Dantadavana, those drugs having the action like antimicrobial, anti-inflammatory, antioxidant. So by this we can prevent the disease, and also we can boost our local immunity. Also we can boost our systemic immunity. So Jiva Nilekana, that is Dantadavana, and Jiva Nilekana act as a virus that will prevent the microorganisms. Further infection we can be prevented. Probable mode of action, that will stimulate the state bud, increases the saliva that contains salivary amylase lysosome. That salivary amylase lysosome, which is the having antiviral and the antibacterial property. So this salivary amylase lysosome, which is present in the saliva, act as an antimicrobial property. So that will prevent the entry of the microorganisms and prevent the further disease. Increased salivation also indirectly enhances the GIT, that is GIT secretion, and improves the digestion, that is Agni Dipana that will do and Jirna will do. Then Uttarottara Dhatu Poshana will be improper, that is from first to final, that is Uttarottara Poshana will be there. Then thereby there will be increase in the Ojas to fight against the disease. Next Ishta Devata Smarana, that is a person could do Mangalakara, and that is the psychological stability will be gained by Ishta Devata Smarana. That is very important in such a pandemic. That is mental stability. We should not be panic. So mental instability that may directly uh, having effect on the respiratory system. Next, Mukha Netra Pakshalana, that is also that is we have to use Vilodaka Kashaya, Lodra Kashaya, Amalaki Kashaya, or the Shitodaka Kashaya. The drugs have the property like anti-inflammatory and also like antimicrobial property. So another washing with the milk like product stigdhata. So milk or other oil substance, if you add some drops of the oil or the milk with the water, and if you go through cleaning of the face means that signata. According to this concept, the signata of the milk act as a barrier. So this due to this signata, that whatever virus is there, whatever microbes is there, that will struck into the this signata, and that will be eliminated, and that will not virus will not invade into the mucous membrane and to the lungs, etc. So by this Netramukha Prakshalana, adding with a few drops of milk, that which we can prevent. Gandusha Kavala, that is same. Pela Gandusha lead to the strengthening of the jaw, while health face improves the taste and increases the appetite. Gargling warm water added with a pinch of turmeric, salt, and a trifala estimado, that is according to Ayush Ministry. So this general also supports that oral hygiene is important in the maintenance of the health and the prevention of the disease. That is because of whatever drugs we are using for the oral hygiene, those are having properties like antimicrobial, anti-inflammatory, antioxidant, and anti-ulcer. That is Anjana. That is also act as a barrier. That is probable mode of action. So Anjana we will use daily. Probable mode of action, that is act as a mechanical barrier for the penetration of the virus or other microbe. Not only coronavirus that acts as a. We have to practice this daily to get this benefits. Next, Nasya, that is also having direct effect on the local, that will boost the local immunity. That is probable mode of action. That is Nasya. We have to use Anutaila, Tilataila, or the coconut, right? 2 drops to each nostril. Proper mode of action helps to avoid the allergy microbes which invade the nasal mucosa membrane and go into the lungs, and allergens microbes and the virus bacteria get stuck into the oil because of that sticky nature. Whatever your oil is released, that will be sticky, that will stuck into the oil, and that will not invade into the mucous membrane. According to another concept, that is due to Sukshma Shrotas, whatever oil will put into the NASA, that will enter into the Shringataka Pradesha, then that will spread into the head and neck via Shrotasis, and that will via other Shrotas also, it will reach to the all over the body and helps to fight against the disease, and that will also prevent the disease. That is Pratimarsha Nasya. Dhumapana, that is very important. Prayogika Dhumapana, we have to practice. That is probable mode of action. When Dhumapana is otherwise ignited, it will resist the smoke. That the smoke again, that will stimulate the respiratory center which are present in the brain. Again, this triggering will help to normalize the physiology and immunity system against the infection. So disinfectant like the drugs like Harita Gukulu Vacha, that can be used for the respiratory hygiene for the Dhumapana. Next, Abhyanga, that is also helps to Jarahara and Vatahara, that will also promotes the immunity, and Pada Abhyanga and Abhyanga, that is imparts the good sleep. Again, good sleep will helps to repair the or repair and heal the body, and again that will act as a defense mechanism against fight the disease. Next, this is also journal. So benefits of effects are they given that Vyadhi Kshamatva, that will the daily practice of Abhyanga, that will increases our immunity. That is Vyadhi Kshamatva. Not only Vyadhi Kshamatva, that will promotes and prevents the diseases. Also, that as the Pushtikara. Pushtikara means that acts as a rasayana. So rasayana means rasayana having systemic effect also. Not only local effect, that will get absorbed through the skin and enter into the system, and in system also that will increase the Vyadhi Kshamatva property. So next, Udartana having the same property. So probable production here we will use the churnas. Next, Vayaman Surya Namaskara, that is Shrama, Klama, Pipasa, Shita, Ushna, Sahishnata. Whatever is that, with this Sahishnata we will get for the Shrama, Klama, Pipasa, and Shita, Ushna. That Sahishnata, that is because of Vyadikshamatva, that is by regular practice of Vayama and the Surya Namaskara. In this, Agni will also get increased. Due to Agni, there will be a proper relation Due to proper digestion, there will be Uttara Uttara Dhatu nourishment. Finally, there will be immunity boosting, and that is the key factor to fight against coronavirus. So increases glycolysis, that is carbohydrate metabolism, and lipolysis, whatever the fat is there, that will be metabolized, and oxygen supply will be increased, and basal metabolic rate will be also increased by this Vyayama Pranayama and Surya Namaskara. That is Ayush guidelines that will be there in website. Just they made a protocol of they just made a protocol, that is a yoga practice, that is start with a prayer, and yogas include yogas that will include Ushtasana, Uttara Mandukasana, Tadasana, Trikonasana, Vakrasana, etc. Also Kapalabhati they integrated in the procedure. These are all will be there in Ayush website. So in Pranayama they indicated Nadishodhana, Ujjayi, and Brahmari Pramanayama. Yoga Nidra that should be practiced once or twice a day, week. So then they given for protocol, that is meditation. Daily we have to go for the meditation. Next, they also made 10:45 and our that is protocol for 10 minutes practical. Who don't have the time, they have to practice at least 10 minutes protocol in this COVID situation. That will again start with the prayer and stretching exercise and asana like Tadasana, Ardha Chakrasana, Shashansana, etc. They are advised, and pranayama, that is Anuloma Viloma Pranayama, and next meditation, then closing with the Shanti mantra. Again 20 minutes protocol, that is start with the prayer, loosening exercise, and yogasana like Tadasana, Padahastasana, Trikonasana, Bhadrasana, etc. And kriyas like Kapalabhati in 20 minutes, and pranayama like Anuloma Viloma Pranayama and Brahmari Pranayama given at least for 20 minutes, and dhyana next closing with the Shanti mantra. 45 minutes protocols that we can practice in COVID situation at least once or twice a week. That will start with the pranayama, the prayer, and the stretching exercise. Tadasana, Vakrasana, Padastasana, Ardha Chakrasana, Bhadrasana, almost all asanas given here. Then Kriya Kapalabhati and pranayama, that is Anuloma Viloma, Ujjayi, pranayama, and Sankalpa, that is Ekoton. These are the pictures. Next, so according to this journal, that is according to this journal, so we can see there is a by regular practice of pranayama, yoga, and Surya Namaskara, there will be inflate and the deflate capacity of the lungs will be increased. By inflate andre akunchana prasarana, pupusadu akunchana prakasarana is increase agutte. By there we can increase the by there strengthening of the muscle will be increased. Respiratory muscles and accessory respiratory muscle will be increased. Another study shows that they taken 50 adult patients who advised pranayama, yoga for 10 weeks, at least for 50 patients who are suffering from the chronic kidney diseases, chronic lung diseases. They advise that is COPD or asthma or something. They advise 10 weeks pranayama. After 10 weeks regular pranayama, they improved, like dyspnea will be reduced. So dyspnea means that is breathing difficulty is reduced, increase exercise capacity. Obviously dyspnea reduced means there is a capacity of exercise will be increased, and oxygenation level. Oxygenation means usually that is a chronic diseases usually having low saturation. Saturation will be increased, and also there will be release from gas trapping. Gas trapping means retention of the carbon dioxide will be relieved by this this due to retention of the carbon dioxide clear means obviously there will be increase in the oxygen. So by this we can conclude that we can add this as a pranayama yoga, we can add this to as a adjuvant therapy, because this will treat the symptomatics, and muscle strength also increase, and oxygen level also increase, dyspnea also reduced, and that is gas trapping also reduced, that is retention of the carbon dioxide, expulsion of the carbon dioxide also reduced. Due to that again saturation will be increased. This is clinical. This is Nana, against Nana, that is increases the pressure. Next, Vasadharana, that is important. We have to always, in such a pandemic, we have to always wear iron cloths only, because there may be chances of microbes and all. Due to iron class, due to high intensity of heat, whatever microbes will be there, that will be get destroyed. Next, Bhojana, that is important. That is one food only we have to consume. So in cold season, all the cold items, there is a replication and the infection of the coronavirus chances will be there. So always warm and current to sneak the, and without talking, we have to take the food. That is also Ojas Balakara, that is give strength to fight against the coronavirus. Sandhya Vandana, that will praying, that will help to prolonging life. And Ratri Bhojana, that should be light, and we should not go for the heavy food. Digestive fiber we have to take. Eat night meal 3 hours after the sunset. That is after sunset 3 hours we have to take before 8 p.m. Nidra, that is very important to boost our immunity. Proper sleep at the night, that is due to the dhatu samyata, balancing the doshas, and sleep at least 2 to 3 hours after dinner. That is better. So this is also that local prophylaxis. All the dinachara procedure act as a local prophylaxis. Next most commonly used supplementation in India for COVID-19 prevention. Next is vitamin C, vitamin D. Those are lab prepared, and probiotic they are using, and antioxidants like selenium and the zinc are the mostly used for the prevention purpose. And concept of the rasayana, those are act as a systemic prophylaxis. We are taking orally and enter into the system. They act as the immunity modulator. So rasayana, achara rasayana, that is vatapika rasayana, we can practice in this communicable disease, that is according to Charaka. Daily we can use Haridra, Guduchi, Estimado, Nimba, Shunti. Singly you can use, or else we can use in the food preparation also. So according to this, that is Rasayana as a immunomodulator. This is a clinical study which was conducted in the Maharashtra. That is conducted on the animal experiment for the 10 years. They showed that Rasayana, whatever Rasayana we are using, that is Ashwagandha, Guduchi, those act as a tissue regeneration. Post-COVID state also, if any tissue damage means post-COVID state also, we can use this ashwagandha or another rasayana. Those act as a tissue regeneration, and also that will helps to stimulate the immunity. Not only stimulating the immunity, those will improving the immunity. So improving the immunity also may have direct relevance to prophylaxis. Prophylaxis means we can prevent SARS-CoV-2 infection by regular practicing the rasayana. That is scientific journal which is conducted on the animal, so shows so many results. Next, you take the example of the Whiteria somnifera. Somnifera, that is, this is the pathogenesis of the disease. Once virus will enter into the inside, that is, once virus will enter, that will lead to cytokine storm, that will leads to the again severe inflammatory changes. Due to severe inflammatory changes, first organ is affecting, that is lungs. Alveolar consolidation will take place. That is I told, that is that will start from the upper respiratory tract. Then if your alveolar consolidation means there will be a state of mostly ARDS, acute respiratory distress syndrome. Later this cytokine storm again affect to the multiple organs, that is called as pyrexia. That is the pathogenesis of the COVID. That is entry, then cytokine storm, then that is lung failure, then other system, all the system, that is kidney, urinary, all system will be failed. That is called as MODS, multi-organ dysfunction syndrome. That is called as pyrexia. This is the pathogenesis. So only Whiteria somnifera, that is acted on all these symptoms. That is only one drug acted in all the pathogenesis of the COVID-19. That is starting from the entry, that only one drug acts as an antiviral and immunity boosting effect. Next, same drug acted as an anti-inflammatory. Same drug acted as a, that is anticoagulant, that is maintain the vascular integrity. That is this is also coagulation will be hampered in this one. That is act as an anticoagulants also. And then alveolar consolidation. Consolidation again leads to the fibrosis. So in consolidation only, that is conserves the alveolar space. Only one drug, that is Whiteria somnifera, that is conserves the alveolar space and prevents the pyrexia. Pyrexia is nothing but multi-organ dysfunction. That is also prevented by only single drug. So only one drug for the multiple symptoms. So in the modern in allied sense, what will happen? Multiple symptoms and multiple drugs. These multiple drugs only leads to the multi-organ failure. 50% corona will leads to the multi-organ failure, and again this medicine we will use as the steroids and anti-inflammatory, this one coagulants. All those these will again by using these drugs also they leads to the multi-organ dysfunction. Not only lungs, also 50% that is due to the corona inflammatory changes. Then remaining will due to the that is by the excess using of the steroids and other drugs, that will leads to the multi-organ failure. So next, behavioral therapy. That is behavioral therapy, that is explained, that is socializing, food hygiene, and everything is explained. So you can everything is there in the book, you can read. Sadhruta work as the more effectively than the immunization. That is very important than the immunization. It is in all aspects. That is acts like the achara rasayana, which is a quality of the rasayana. Any person can prevent himself from the disease. That is achara rasayana. So spiritual aspect of the COVID-19 according to Ayurveda. What is the spiritual? It is a non-pharmacological. That is, we will not use any drugs. that is by spiritual aspect of the COVID-19. That is the spiritual aspect of the COVID, that is Sattva-Vaja Chikitsa and Daiva-Vapashaya Chikitsa. Sattva-Vaja Chikitsa, that is important, that is directly related to the Sattva. So maintaining, that is we should not be anxious or we should not be depressed. So these are the symptoms or the psychological symptoms directly related to the respiratory system to hamper the respiratory. Who are having psychological effects, those are more prone to get respiratory infection. So boosting this immunity is very important. So again, there's Homa, Japa, Tapa, Havana, and Yagna. These are comes in the non-pharmacological prevention, that is by Homa, Havana, and Dhupana. Also Charaka husband, Mantra Chikitsa. Now we are following it as a Raga therapy. So this article also tells that whatever drugs we are using for the Homa, Havana, and Dhupana, those are having antimicrobial and antifungal property. Whatever surrounding that will attach to the utensils or that will be there in the air, that can be cleared by fumigation. That is by the Homa, Havana, Dhupana. So Dhupana aspect, that is same. That is already explained in the starting. So microbes, whatever pathogens will be there, that will kill. So that will be there for 74 hours in the air. That will attach to the particulate matter which is present in the air. That will survive in the 20 to 25. If you are putting Dhupana, means all that pathogens will be killed. So main actions on property of the Dhupana Dravas are they act as an antimicrobial. Not only antimicrobial, they act as an antifungal. They will boost the immunity of the environment. Next, Dhupana Dravas commonly we can use Gugulo, Ushira, Vacha, Nimba, etc. So these are the scientifically proved that is a Gugulo, Usha, Vacha, Rasa, Nimba, and Darka that can be used as an antimicrobial and antifungal also for Dhupana or Homa Havana Karma. This is spiritual or the Daiva Vapashaya Chikitsa to prevent the COVID-19. Steam inhalation aspect of the COVID-19, this is also important. The role of improvement of the nasal condition, reducing the congestion, also inflammation has been reported in the several clinical. As a COVID-19 is in the inflammatory case, that by steam inhalation we can reduce. So, several clinical studies conducted. I will tell this is one clinical study. So 62 positive patients in the one that is a hospital. 62 positive patients are there. They divided into symptomatic. First group is divided into symptomatic, and second group divided into asymptomatic. Asymptomatic means only they taken mild to moderate case. They excluded the severe case. So first group they advised 5 minutes of inhalation. First case, that is means COVID positive who are asymptomatic. COVID positive tested for the COVID positive and asymptomatic. They are advised twice a day for the steam inhalation. After 5 days, those symptoms will get those after testing that is came negative. In second group, mild to moderate cases taken. So those mild to moderate, they asked to every 3 hours to inhale the steam for the 5 minutes every third hourly. So every third hourly they inhaled. They given in the second mild to moderate. So after 1 week or after 9 to 10 days, whatever symptoms are having those patients, mild to moderate symptoms, that will completely reduce. And after 10th day, they tested negative for the COVID. So this is because hypothesis behind that it is whatever steam we are inhaling that will increases the temperature up to that is 70 to 80 degrees Celsius. Temperature will be rise due in such a temperature that virus, not only corona, other virus will not survive. So this is that will destroy the coronavirus. That is the hypothesis. Next, other tulsi, shunti, maricha that can be used for daily, and also milk medicated with the turmeric that can be advised by the central ministry that can be consumed daily. So, if any doubts, you can. If any doubts, you can mail me on this mail. Thank you.
Thank you, sir. The session was very informative. Now, I introduce the next speaker of 5th scientific session, TATVAPRABODHINI, Dr. Rekha BV. Ma'am has completed her BAMS and post-graduation from STM Ayurveda College and Hospital, Hassan. Ma'am has completed PhD in the year 2017 under RGUHS. Ma'am has 12 years of teaching experience. She worked as assistant professor in STM Ayurveda College, Hassan, and as associate professor in JSS Ayurveda Medical College and Hospital, Mysuru. At present, ma'am is working as professor in the Department of PG Studies in Sostavruda, Government Ayurveda Medical College, Mysuru. Ma'am has given talk as a resource person in several seminars and guided 8 research projects under food and applied nutrition in DFRL. Ma'am will be speaking on the topic relevance of Ahara with special reference to nutritional requirements in COVID-19. I welcome you, ma'am, for the presentation.
Thank you for introducing. Good afternoon, everybody. Om Shri Dharmantara Namaha. Myself, Dr. Rekha, BV, going to share my today's view on the topic relevance of Ahara with service nutritional requirement in COVID-19. Contents of my talk: introduction, relevance of Ahara, concept of nutrition, nutrition in COVID-19, and conclusion. I am going to begin my presentation with the famous quote, Annam Brahmam, as everybody is knowing the divine reality. Because as we are known that our Sharira is made up of Anna or the Ahara, by giving due respect and importance to this, definitely going to maintain our Swasthya. As we are knowing, Anna cannot be replaced that Ahara with any of the things in the world. That is the reality. Food plays a major role in making maintenance of immune system. Adopting the principles of dietary practice meets the immune system demand for energy and nutrition. As we know that Agni Bala and the right kind of food are the most important factors in promotion of health. Not only supplementing the nutritional requirements, the present word is going behind, but also body's ability to absorb nutrients is equally important. And why this undernutrition impairs immune function? Immune system is considered as the frontline warriors to safeguard our body. Hence, its damage or insufficiency will have the devastating effect of the body. Coming to the relevance of Ahara, we are what we eat. This is the reality. This explains the importance of proper food and food habits in life. As we know, it is the prime factor necessity for of all the individuals. Patya, the diet, plays a vital role in the maintenance of good health, prevention, as well as the curing of the diseases. Our science 500 years back, the Ayurveda emphasized the proper food habits since then, whereas the modern medicine, nutrition, and dietetics as a science was developed towards the end of the 20th century. Unfortunately, this holistic approach to dietetics and perfect health has not been given the due importance at the present situation. The concept of Patya and Apatya is the unique approach of Ayurveda. As we know that the proper knowledge of this is essential for the proper maintenance of disease as well as the swasthya condition. Repeatedly telling, Agni Bala plays an important role in the planning of Patya. Our acharyas have given due importance. As in the modern concept also, the healthy gut supports the immune system by providing probiotics and prebiotics. A good and proper nutrition in the disease is worth 100 medicines, and no amount of medicines can do good to a patient who doesn't observe the 6 regimen of the diet. At the present condition of pandemic, this will very much suiting. The patya and the diet should have the qualities like hitahahara, satmya ahara, aviruddha ahara, and sarvarasa sannivishta ahara. The concept of our acharyas will be having its own role in the contribution towards the nutrition. The basics for the diet therapy in Ayurveda, we are having a very good references as everybody is familiar with all these shlokas which gives the perfect reference for planning of the diet. Our acharyas have given the diet in long back year only for the swastha as well as the aturas also. Coming to the importance of ahara, as we all explained, nothing can be replaced with ahara as it's having the lots of concept. Coming to the concept of health or the swasthya, see, ahara and achara will be used to the arogya. Here also prime importance was given to the ahara. And trayopastamba, ahara is placed as the first. That is the giving due respect due to this. The sharira itself is formed due to the ahara and the composition of ahara. Coming to the ahara vargikarana. Why should we have the knowledge of ahara vargikarana? Anything of planning of any nutrition or anything, our acharyas long back only have the sufficient abundant knowledge regarding the nutrition according to me, because they have nicely divided on the basic concept and the composition of nutrition only, that is tavara and jangama. In the form of intake, we are not taking ahara in the raw drugs, is it? We are taking it in different forms like ashitam, pitam, kaditam, lidyam. According to the different things, we can plan well for the present situation also. In different forms, we can have our diet preparations. Depending upon that, which is Hita and Ahita. We should always give importance for thinking at any condition, planning for Swastha as well as Atura. We should always keep in mind for planning of the diet. So only we can plan the required nutrition to our body. And the Manasika Bhavas like Satvika, Rajasika and Tamasika, according to the presentations of 12 Vargas. Why in Ayurveda this presentation has been given? See, the composition of our acharyas long back only, having the abundant knowledge regarding the nutrition, classified very well like Shukadanya, Shamidanya, Mamsa Varga, Shaka Varga, because one should have the basic knowledge for the planning of the required nutrition, not only at the present pandemic condition, to improve our immune system also, one should have the basic knowledge of all the Ahara Vargas. Then only we can plan the proper diet. And Sadapatya Aharas, our acharyas have given much importance for Sadapatya Aharas because which are the eligible things which we can consume daily, like Shastika Shali, Mudga, Saindava, Amlaki, Yava, Antariksha Jala, Paya, Sarpi, and all these things can be taken daily. But see, Nitya Sevani Ahara, our Charakas concept of nutrition, is well maintaining with the balanced diet at present what the nutrition will believe. It composes very nicely Sastika Shali, Yava, Mudga, Jangala Mamsa, Amlaki, Saindava, Antariksha Jala, Shira, Sarpi. It will all composite the macro and micronutrients which is of daily consuming. It was planned, not now, 500 years back only, our acharyas have the concept of nutrition very well, but they never explained in the form of calorics because they have the idea that individual varying is very important because it is not same the caloric values for all the individuals. Keeping in that concept only, our acharyas have concentrated on the patya both for the swasthya as well as the aturas. And giving due respect to the, I'm just explaining the basic concept which are all the things should be considered for the proper planning of any ahara or the diet. Ahara vidhi visheshayatana, ahara vidhi vidhana, ahara vidhi viruddhahara, nindita bhojana and asavana pravicharana. See, one should give the basic knowledge of all these to plan. And this is the important principles of food intake. As our Acharya has explained, in the present condition also, pandemic, the stressful condition, we should think first properly when to eat, what to take, how much to take, how to take, and what to do after taking the food. Common queries. So, for all these conditions, we should also give due importance to the Prakriti, Karana, Samyoga, Rashi, Desha, Kala, Upyoga Samstha. That is the rules for eating. Upayokta, person who takes the food. See, these are all the basic things one should have knowledge to compass how much the nutritional requirement for present pandemic or any time. For any time, these are all the basic things one should give importance. I am stressing these rules for taking food means at the present pandemic also, they have repeatedly telling Ushnam Ashniyat, Signam Ashniyash, Matram Ashniyat. And these are all the factors it is aiding mainly to the metabolism directly because we are telling nowadays also have the freshly prepared food. Very tasty also according to the Agni Bala because the present pandemic condition of having our colleagues have explained the different signs and symptoms. According to that, one should plan the diet by keeping all this the basic concept of what our acharyas have told. Then Ishtadesha. You see, these are all how nicely, beautifully explained by our acharyas, which are indirectly influencing the metabolism. Then Ahara Pravicharana. That is the applied aspect of dietetics. We'll get the very good references in Shushrutacharya. Because see, in any conditions or present pandemic conditions also, it will be having the different signs and symptoms. Each individual is different because on the basis of the concept of each individual signs and symptoms, we should select the food articles. That's what I have given the basic references starting from its Vargikarana and the principles. By keeping in this mind all these concepts, we can plan very important. So why I am giving stressing to these principles? To keep the Agni in the Samavastha, to aid the metabolism, and if that not happens, the health is not promoting. If not diseases, it is going to cause the death also. Why this much variation is causing nowadays? Because of the improper modernized food habits have made the person victim for various disease. A contribution of the rapid change in the culture. Everybody is telling our Indian traditional culture is for the food, it is having its own medication in that only, and giving due importance to the age, because the calories of planning of the diet mainly varies on the age, gender, and the work what the that is the on the basis of this only the calories of nutrition also been divided in the pregnant women, lactating women, and the heavy workers, and all these basic concepts should be taken. Coming to the concept of Patya Kalpana, the Krutarna Kalpana. Up to those, we are having the proper knowledge of how the principles, how the Ahara Dravyas will be classified. And also we should have the knowledge of different preparations of Patya Kalpana. As we told, Dravya Bhuta and Adravya Bhutas. In Dravya Bhuta, here the Ahara can be used as the Aushadhi as well as in Swasthya also, Nitya Upyogi and the Rasayana factors, because it is having the properties like Shrota Shodhaka, Ojavardhaka, Nidana Parivarjana, Doshahara, Dhatu Samyata, and Prakriti Stapana. And keeping in mind that Patya in Ritucharya, it is also one of the important factors one should give importance, because Acharyas also given, take the seasonal food and regimen should be followed where the doshas will be impairing. To keep it in the Samyavastha, one should follow the Ritucharya. And also we will consider the Prakriti, because each Prakriti of the persons, we can select the food articles. It is going to definitely help to promote his health. Agni, because here the human physiology, we should give importance for the Agni. As we know, it is the core temperature, it will directly or indirectly, metabolism, it is influencing. Agni Dushti increases the inflammatory changes. Agni strongly influences the immune system and core, because at the present, everything we have to do that immunity should be maintained properly, everybody's mind. So how we should give respect to our Agni, because it important thermoregulation disorders, because abnormality induces the decrease in the thermoregulator. And the role of Agni, whatever may be the amount of nutrition, one should give importance for this, or food that are being consumed, unless there is no bioavailability, it is of no use. Keeping perfect metabolism on the Agni is the best crucial for this. And excess nutritions, one should note this, excess nutritions are converted and stored in the adipose tissue, liver, and muscles during the time when nutrients are abundant. So recent studies of research indicates that cellular metabolism plays a key role in supporting the immune cell maintenance and as well as the development. Rasayana Dravyas as Ahara, that is consumed by keeping the present condition, we have listed as our Acharyas told, where the Matra and Samskara should be given importance. Milk, ghee, Indian gooseberry, honey can be taken as a regular Rasayana, and use of some spices in the as an immune booster is also important, like Karkam, that is Haridra, Shunti, and Lashuna with proper hydration. Let us have the basic knowledge of concept of nutrition. As everybody knowing, nutrition is a science of food that examines the relationship between the diet and the health. Nutrient or the food factors used for spicy dietary specific constitution. Diet, a usual food, a restricted selection of food. Dietetics, the particular application of principles of nutrition, including the planning of meals or the well and the sick. Both the dietitians or the health professionals who specialized in the dietetics are trying to provide the safe, evidence-based dietary advice and intervals. Good nutrition maintain a nutritional status that enables us to grow well and enjoy the good health. So this science of nutrition attempts to understand how and why the specific dietary aspects will be influences on the health. It is having the community aspects of nutrition. Different programs is also going by the government, and the classification of the food groups. One should have the basic knowledge, as we are told that our acharyas also give importance while the classification, because for what's the available things, for proper planning, the individual should have the basic knowledge that the food consists of mainly the division on the basis of their chemical composition, like macronutrients and the micronutrients. This everybody will be knowing. The macronutrients mainly constitute for the carbohydrates, proteins, fats. micronutrients like vitamins, which are the fat soluble as well as the water soluble, and the minerals, major minerals and the trace minerals, sodium, potassium, chloride. Because why I am stressing this is at the present symptoms, it is variation because of the fever and all. The proper maintenance of these conditions, of this body condition, these are very important of copper, zinc and all. Coming to the classifications, as you told, on the basis of origin and plants, proteins, the reputations, and we will be having the bodybuilding foods like milk, meat, poultry. This is all the bodybuilding foods. And energy yielding foods are cereals, sugars, roots and tubers. And the protective fruits are vegetables, fruits and milk. Cereals, pulses, vegetables, nuts. So everybody is familiar with all the classification of the food articles. As we know, what is these nutrients? Again, it is the inorganic complex contains in food. About 50 different nutrients are normally supplied through the foods, and each nutrient has the specific function in the body. Most natural foods contain more than one nutrient. Poor health can be caused by the imbalance of these nutrients, either in excess or deficiency. So one should give importance for this. And as we know that because of these all the qualities, it should be strengthened, and nature the links are continuously under investigation. According to the United Nations of WHO in 1996, more than starvation, real challenges has been developed for the malnutrition. So it has planned the deficiency to come back by planning the ensure the growth and maintenance of the vital function. So macronutrients, which is the range of nutrients that provide energy or essential for the growth and maintenance of the body, essential for the proper body functions and the body requirements in the large amount. So protein requirement 10 to 15% among the food, and fats of 15 to 30%, and carbohydrates of 50 to 80%. And the micronutrients, it may be required in a mild form, but the body requires in very, very small amount. So what are the dietary sources of vitamin C? Instead of composite on the present pandemic conditions and all, this the dietary source of giving vitamin C, we can select our food articles through the food. The dietary source of vitamin C requirement, you can go through the any nutritional books will get it if you had the confusion. So Indian gooseberry, guava fruit and drumstick, some are having the vitamin C rich source, so you can select while selecting the food articles. And the dietary sources of zinc also, we are having the minimum composition, because zinc, as we know, it is the main to maintain our gut in the specific good healthy condition, so the absorption rate will be good. Based on the nutrition values, this all the classification has been done because according to their requirements. Cereals and millets, it is required as the staple food form of 80% in the dietary calories. It contains 6 to 12% of protein. Good source will be the B1, B6, which are all very required for the any pandemic conditions. Not only that, any sorts of viral infections, and to maintain the good health also. We should never think only the diseases. To compact that, because as we know that to compact the good immunity, by having the, instead of drugs, better to prefer the food articles. And the pulses, which are rich in protein to 19 to 24%, good source of B complex, deficiency of vitamin A, D, B12, and the puffed pulses are used as a snacks also. Nuts and oil seeds contain 80 to 40%, soya bean of 40%, and vegetables mainly rich in the contents of vitamin A, C, B2 and folic acid. Daily consumption is 50 to 100 grams, and it is the cheapest protective food. We should also think of the cost effective while planning the diet. And the fruits, like good source of vitamin C, we should select it. And the milk and milk products are very essential for the deficient, because it is the essential, all the proximate principles will get, and it is available. We should see while planning the diet also what's the locally available things: iron, vitamin C and zinc, and reconstitute with 7 times of weight of warm water and used as a milk. Eggs contain 30% of protein and this source of vitamin A and D, some B vitamins. Do not contains of vitamin C. And these are all the fats and oils, source of energy and provide. That is the essential fatty acids, butter, ghee. This all can be included in our dietary planning. Sugar and other carbohydrates, mainly the source of energy, and condiments, not important source of nutrient in diets, but enhances the palatability of the diet, helps to improve the flavor and taste. I am stressing this because at the present condition, only of having the food is not, but it should be somewhat flavored, tasty only, we will like to have it. So we should concentrate for adding the adjuvants to the food articles. Functional classification of food. The US Department of Agriculture has suggested the 3 different group plans: 7 food group plans, 4 food group plan, and 11 food group plans. Because on the necessity and the requirements, according to that only they have planned. See, in the 7 food groups, green and yellow vegetables, like it is easily understandable. They'll give you the charts so that you can plan and one can follow it very easily. And the oranges, grapes, and salad, tomatoes, it is rich in ascorbic acid, the main nutrients, along with the different groups of vegetables it is giving. And this is the 4 food groups: milk group, meat group, vegetable. It is both for the vegetarian diet as well as the normal diet. And the food groups of containing of the 11. These are all along with the main nutrients one can plan it. So planning of these balanced diets. A balanced diet is one which contains the various groups of foodstuffs in correct proportion. One should have it, provides the minimum requirements of all the essential nutrition. One should give importance that it should contain all the essential nutrients, difference according to the age, sex, physical activities, economic status, and the psychological status. Balanced diet formulation, one should always keep, now what's the government planning or anybody, balanced diet at high cost. If there is a different category of peoples, according to the society, their need, we can plan according to the cost. Cost is also one of the important factor, one we can plan it comfortably. Balance that at moderate cost, low cost, and high cost. We should have the knowledge of this so that we can plan the diet. As been all my colleagues have described regarding the common symptoms in the COVID-19, I am stressing it from the beginning. According each individual wise, it will be different, and it is of with the symptomatic, asymptomatic, primary context or the secondary context. Mainly, we can hold this by having the proper planning of diet also, along with the some may require along with the medication. Fever is an elevation of temperature. As we know, it ranges from the imbalance between that. There, we can prefer the medications like mild sweating, it is there, or lie down on the bed, drink the hot water as much as it is required. And food should be included at the fever condition. Some will be associated with the fever for 2 to 3 days. At that time, we should plan. At the fruit juices, milk, barley water, thin dals, gruels, soups, glucose water, coconut. See, lot of option is there. Better at that time, there will be loss of appetite and the taste will be also not there. So at this condition, we can plan it in a way according to the cost wise also we can give the importance. Food should be avoided, because why this all should be avoided means there is a loss of appetite. Our gut is not enough to absorb the proper nutrition. So we can reduce the rich oily foods or everything at that condition until our Agni or the appetite will get improves. Points to be noted while planning: patient should have the poor diet and the food must be appetizing and according to the patient likes and dislikes. This is why nowadays at the panic, COVID also, the patients are very much stressed at this condition. They are not liking to have, because so in this condition, we should counsel them patient and we should according to the taste requirement of the patients, we should add up some of the adjuvants and make them to have the food. The first 2 or 3 days of the diet should be more of fluids only and feed in the small feeds to get the frequent intervals. In addition, amount of citrus fruits such as orange, sweet lime, lemon, gooseberry, these are all the supplements we can include for this diet. The high calories, high protein, liberal amounts of fluids and vitamins and minerals should be given. The fluid intake must be liberal to the losses of the sweat and the permit the adequate volume of urine for excretion of the waste. Milk, glucose water, soups, fruits, juice, and water can be included in the meet this demand. I am stressing the fever is it is the commonest symptoms which is experienced in the present COVID-19 patients, and they will be having the general debility and loss of appetite, loss of taste, smell, and all will be there. So we should plan the diet in such a way. Easily, as I told, it is should we consume the easily digestible diet. Mainly prefer avoid the raw things. Boiled and steamed vegetables preferably should be given, and soups form, fruits and fruit juices, cow milk 2 to 3 times a day. Khichdi with spices like cumin, coriander, turmeric, asafoetida, ginger can be added. Bitter gourd and cooked radishes, small amount of whole grain bread patient should take at the ample rest also. Because as you know, the rest is the also one most important factor where the wear and tear of the body will be repaired. Avoid the heavy food that will be difficult to digest. Diet high in saturated fats, salt, sugar, nicotine, alcohol, sedentary lifestyle, too much of exercise also should be avoided. The diet in peak fever, we can have the full appetite, only the liquid fluids can be then. Then Krutana Kalpana, I like to highlight some of the few preparation which is told by our acharyas, because only having the value of nutrition requirement is not enough at present, because as we know it is giving only the raw food articles. So method of applied analytical study of prepared nutrition is just going on at the present. So all will be having the knowledge of only the raw drugs, food articles. So they will think that for 100 grams, 80%, 80 calories means it is not the thing. It again varies depending upon your method of preparation. Our acharyas has given, and in Brava Prakasha, you'll see different sorts of preparation and by the principles of aharas. So one has to give importance not only the raw food. The method of preparation is also important to maintain or retain the nutritional contents in the food articles. Like manda, that is the different forms of ganjis, our acharyas have explained. This also will be helpful for the different condition of the present symptoms of the COVID-19, where it will help to improve the appetite. And then is Ashtaguna Manda. You see, this is all Deepana, Pradhana, and it is also Jwarahara, Swarva Doshahara. These are all the some of the medicated like Ganji, Kashayas can be included in our diet. Then Panchakola Fanta. These are all the Tridoshahara, Jwara also, Deepana Pachanaya like. Because if it is associated with the sore throat, cough, throat irritation and all, this will be very much useful. One can include this, the preparation. Paya, this also having with the nutritive value of paya. This is the prepared food nutrition I am telling, not of the raw one. The prepared one of the analytical study gives that 94 calories of diet. This is the sudden energy boosting calories should be required at the time. So we are preferring the rice ganji only at that condition. As we know, it is the rice is the easily digestible food in method properly prepared one. And the nutritive value of anna is for 100 grams, it is giving the, this is the prepared food articles calories I am stressing. And the different kinds of yushas one can have with the pulses, because boiling any type of pulses but not with the rice. That is one part of the ahara dravyas with 18 parts like mudga yusha, chanaka yusha and kulata yusha. I am giving little examples of this prepared one. One can have plan this. It is easily available in your home only. One can prepare, and it is also cost effective also, not of high cost diet. So we should see, because of the daily preparation of the diet, one should know that it should be locally grown and it should be locally available for the low cost also. So dietic preparation of this Kruta Anna, where it is having the Anna should be prepared properly and it can have it for the Brahmanya purpose. And the dal soups can be also prepared, and it is the present diet charts what our government is prefer, where it is having the breakfast and is having the lunch and the evening dinner and all. It's all concentrated giving for both the symptomatic, asymptomatic, primary contacts and everybody. So you should be having all the basic requirements of nutrition. At present, what we are following the model diet chart. Strictly avoid the alcohols or the other things, because our acharyas also told that for following the swastha, both for the aturas, they have to have the sadrutta palana. So that is also one of the important factor at the present days to plan the diet. Coming to my conclusion, according to mine, adopting the principles of ahara in the selection of food articles and also in the preparation of foods, which is explained in the dietary factor, is very much important. Required amount of nutrition and its bioavailability will help to support the proper functioning of the immune system. Take home message: one must eat to live, not live to eat. Your proper nutrition is or the diet is a bank account, and good food choice are the good investments. So everybody, me, not only in the disease condition, better to have the good investments in your account so that your immunity will be maintained. You can face not only the coronavirus in future, what are all the virus or what are all the disease condition. Try to maintain your immunity by the good investment. Any queries or inputs are welcome to my mail nisargarekha@gmail.com. Thank you. Thank you everyone for the patient listening. I am very much thankful to our principal, Dr. Gajanan Hegde sir, for giving me this opportunity, and all the organizing committees who has given me this opportunity to share my views. I am thankful to everybody for giving me this opportunity. Thank you, one and all.
Thank you. Thank you, ma'am, for the insightful session. We now conclude the fifth scientific session of TATVAPRABODHINI. The sixth session will be held tomorrow. Speakers for morning session will be Dr. Nalini N and Dr. Maitre RC. Speakers for afternoon session will be Dr. Sidram Guled and Dr. Ashwini Patil. So stay tuned by 11 a.m. tomorrow.